Frequently asked questions about nasal surgery. To cover those questions, we've got Dr. Prashanth Reddy. First question: will there be any scars on my face or neck after the surgery?
So, in an endoscopic nasal surgery, this surgery is performed inside the nose with an endoscope where there won't be any cuts or scars or bandages on your face if it's performed by me. There won't be any cuts, no bandages, no scars on the face.
Can you explain endoscopic surgery in a very simple way?
Endoscopic surgery is nothing but a thin rod, which is a telescope, which goes into the nose, and we operate inside the nose, visualizing the whole aspects of the nose on a big screen where the whole image is enlarged to almost 5 times the normal size. So, in that magnification, we do very precise work where the nerves can be decompressed, the sinuses openings can be widened, the pus or any sinus infection, which is either bacterial or fungal, can be drained out fully with very, very minimal uh, issues inside the nose.
What steps do I take before I get into the surgery?
So before you get into the surgery, you would be consulting me first. I would be examining you, assessing what is happening inside the nose. I would have given you a prescription for getting a CT scan done. So kindly get the CT scan and review back with me. Once the review is done, I'll show what exactly is happening inside the sinuses, inside the nose, where is the nerve getting pressed, what are the issues which are causing leading to your symptoms, and how I will address it. Everything will be done inside the nose, so there won't be any changes with the perspective of the surgery because it will be still the endoscopic surgery. The only thing which you would look for before surgery is ensuring that you are getting the CT films to the surgery on the date of surgery, because without the CT films it's very, very difficult for me to operate, and without the CT films I might not even operate you.
What should I do if my nose starts bleeding after the surgery?
So after the surgery, the bleeding is expected for about 2 to 3 days. If at all there's a frank bleeding, all you need to do is pinch your nose like this, bend forward, breathe through your mouth. So when you pinch like this, hold it for 2 minutes. The bleeding will stop. In case the bleeding doesn't stop, you will have my team's WhatsApp number. You can reach out to my team. They will suggest what needs to be done. If you are in the hospital, the nurses around will help you out. There will be duty doctors who will inform me, and I will come and attend to whatever is the issue.
After my nasal surgery, when is my next follow up session?
After the nasal surgery, there will be 3 follow-ups which I would recommend. The first follow-up is after 7 days, where I would be removing the splints which I would have placed inside the nose, if at all the splints are placed. If the septum is getting corrected, if the septum is not getting corrected, then there won't be any splints placed inside the nose. The second follow-up is 3 weeks from the time of surgery. The final follow-up is 2 months from the third week. So almost the fag end of 2 months, 3 months, you will be coming back to me for an endoscopic evaluation. So in both the evaluations, I'll be checking how well the healing process is going on, how you would have washed your nose, what are the blood clots which are there, and accordingly take things forward. Either increase the times of nasal washing or reduce the chances of times of nasal washing.
How should a nasal wash be done?
After the surgery, the duty doctors or the nurses in the hospital will teach you how to use the nasal wash. So, nasal wash is a bottle which you will be pouring in RO water to the level of 200 ml. You'll be mixing the sachet which is there in the starter kit. Along with that, there's a tablet called betamol fort which you need to powder and mix it into that. So once that is whole, once both the powders are mixed, you need to shake the whole content properly to dissolve the whole content, and you will be putting the nozzle into the nose and squeezing it. So once you squeeze, it will go into the nose, it will circulate around your sinuses, it will wash out all the debris, the blood clots, the fungus, the pus, any small bone debris, all of that will either come out through the opposite nose or through your mouth, or even it can come out through your same nostril. So washing it is very important, ensuring that you finish the full squeeze gently for longer duration, and you need to finish the content of the water of 200 ml in a maximum of 4 squeezes. So once you squeeze that bottle, the whole content should go and wash the whole nose and come out. The ideal best way to finish it is in 2 squeezes, where you squeeze one full thing, 100 ml goes and washes one side, other side you squeeze and the other 100 ml goes and washes the other nostril. So that's the ideal way to wash it.
How many times do I have to do nasal wash?
So the nasal washing, ideally, if you do everything properly, I would recommend 3 times in the first week, then 2 times the next week, and next 2 weeks, and reduce to once in the evening time for 1 month, and alternate evenings the next month. So that's how we taper it down. And if at all you have fungal infection, then I would reduce the dose based on the endoscopy.
What conditions can sinus surgery treat?
So, and the endoscopic nasal surgery will treat all the symptoms what you might have. You might have headaches, you might have neck pains, you might have shoulder pains, you might have back pains. You will be having sneezing, you will be having nose blocks, you will be having bad breath, you might be having snoring, especially in females. If you have period cramps, that also will get cured. If you have acidity or bloating of the stomach, that will also reduce post the nose surgery.
What tips do you have for me to ease my discomfort after a surgery?
So after a nasal surgery, the best way, you will have little bit of congestion in the nose because I would have placed splints inside the nose and also the blood clots which would have formed. So wash your nose properly. As I told, washing is very essential to ensure that the healing process of your nose is good post the surgery.
Can I still see my doctor if I'm facing some symptoms? And what are those symptoms?
You can definitely reach out to my team of doctors on WhatsApp. My team of doctors will definitely respond to you on WhatsApp on messages. If you need to connect with me, you can call the same number, or my secretary will answer and she'll connect to me. In case there is anything that you want to see me physically, you can definitely book an appointment either on WhatsApp. My team of doctors will respond back and they'll book the appointment, or you can call my secretary and book an appointment accordingly and come and visit me.
And can I take a bath after the surgery?
So after your nose surgery, especially if it's an endoscopic surgery, there won't be any cuts, no bandages, no scars. So you can directly go swimming, you can do everything. Only restriction is no flying, because the splints inside the nose can hamper your eustachian tube and it can lead to ear pains. So that's the only restriction of no flying for about 7 days till I remove the splints. Post that, you can do everything.
Can I move around after my surgery?
Yes, you can easily even do work from hospital if you have work from home. So WFH is not work from home, it can be work from hospital too immediately after surgery. That's because you'll be absolutely fine. There won't be any restriction for you. So you can do everything normally without any rest.
And what diet should I follow after the surgery?
Diet is normal. Whatever diet you were having before surgery, pre-op, you can have the same diet. The instructions which I would have given you in the prescription, kindly follow those instructions. That will ensure that you'll be feeling much more better.
What happens soon after the surgery? Are there any risks involved?
So immediately after surgery, you will notice little bit of nose bleeding and little bit of congestion in the nose because of the blood clots inside the nose. So nothing major to be panicked about. As I explained, if at all there's any issues, you can reach out to the nurses or the duty doctors. They'll get in touch with me. Almost all the duty doctors in all the hospitals where I operate are well trained and they do take care of you very well. There's no risks involved.